Well, hello everyone. My name is Lucia Esposito. I am with the Broome County Office for Aging, and I'm very sorry I cannot be at the ACUU this year. I'm glad to be able to share some feedback about our wonderful partnership with Blooming Health. So some background about Broome County Office for Aging. Our office is part of Broome County government, and we have been in our community since 1974. In fact, this year we are celebrating 50 years of providing service to older adults in Broome County. Broome County is part of the Southern Tier region, and our county is considered mostly rural, with City of Binghamton being the largest municipality. The county population is about 198,000 people per the 2020 census, and the 60 plus population is about 27% of that, with that number, of course, expected to grow. Kind of going over the 2 years that we have been with Blooming Health. The first year of our Blooming Health partnership, we started in February 2022, and the initial steps took a while to get us going. We had to create a paper consent form that our legal department approved, so that took a while. Then we had to get our consent forms to our senior centers to get some initial people enrolled, which of course took some time, and explaining the consent form and what it is for to our staff, and then the staff communicating that with clients to explain the benefits of the service. So our enrollment, I would say, was quite slow because we had to kind of figure things out as we went. We created groups of registered participants by each of our senior centers in order for us to be able to target our messaging. We then moved on to enrolling our Meals on Wheels clients. We sent the paper consent forms to them with their meals, with the help of volunteers. And of course, as you can imagine, handling paper, some of the consent forms did not come back, so we had to follow up again. So some of these challenges, slowed us down, but we worked through them. Really, it was about helping clients understand the benefits of the service, working on our introductory messages to have the right wording. So because it was a brand new service and a brand new concept for us to be able to use alerts sent to people's phones, our older adults were not necessarily used to that from our office. And of course, also looking at how can we limit the number of messages sent out to people to avoid confusion and maybe overwhelming them as we started. Now, second year, I would say was much smoother for us. We were kind of used to the platform. We understood the consent process. And as of today, we are at about 5,000 participants enrolled on the platform. We've been able to increase our enrollment because we figured out a way to send consent messages directly to clients. So we pull peer place reports a couple times a year for each service. The consent messages are sent to people's phones via text or voicemails, and that speeds up our enrollment process, and it has made it much easier than handling paper consent forms. As I mentioned earlier, we focused on kind of creating groups on the platform, depending on the senior centers, Meals on Wheels clients. We have a general group, general OFA messaging. So if it's somebody just wants to know about, a lot of our events and not specifically tied to a center, they are in the general OFA group. That's probably our largest one. I believe it has close to 3,000 participants enrolled. Caregiver group to send out specific caregiver messaging about support groups, caregiver training events, respite options. Foster grandparents program, we send reminders about their in-services, turn in your timesheets, whatever other alerts the coordinator needs to send out. And we also have a couple special interest groups that we have set up, and they're tied to special programming like our evidence-based Walk with Ease and some other groups. So each month we look at our senior news publication, which is a monthly newsletter that goes out to about 6,000 people in Broome County, and we schedule our broadcasts based on the events and activities listed in the newsletter. That's about 20 to 25 broadcasts each month. Most of the times it's special dinners, special lunch events, such as, Mother's Day, Father's Day, Valentine's Day, holiday parties, summer picnics. And it's really helped us improve people's knowledge about the events and has helped us be kind of diverse. So we have the paper newsletter, but we also have an electronic way to remind people last minute, the week before, hey, don't forget this event's happening. So kind of multi-step approach or multi-method approach to reach seniors in different ways. Some seniors or older adults prefer the printed version. Some really like the electronic reminders or the alerts going to their phones and voicemails. So we've really, I feel that we fully utilized this broadcast option through Blooming Health, and has really helped us. In late 2023 and in early 24, we started using Blooming Health to send out our customer satisfaction surveys, which we all have to do for most of our programs once a year. However, we have been able to create, especially for the congregate meal program, surveys that go out every couple months. So actually, each senior center gets a survey almost after every month is wrapped up. There's a survey that goes out to a senior center. So we are surveying multiple times a year. We're getting more real-time data. We don't wait for the year to wrap up and then ask about how was the congregate meal program. So it really helps us look at also at the data by each senior center, right? So how was the meal program at one of the senior centers this past month? Were there any specific issues, any suggestions? And that data I receive, I can communicate to the coordinator, who then can address some of the issues that we're learning about. We've also done a survey for caregiver services and transportation. These two surveys for these two programs were done over the phone in the past, and of course were time consuming. We couldn't get a hold of clients, had to call back, find a staff person who has the time to do it. So this has really helped us save a lot of time and get the data we need. And we also were able to participate in the AARP project with Blooming Health, where we sent out targeted messages about financial benefits such as HEAP, SNAP, Medicare Savings Program, Lifeline. Through these messages, we were able to ask clients, are you interested in learning more? And are you also interested in us helping you enroll? So after we got the lists back to us from Blooming Health, our staff were able to reach out to those who said, yes, I would like to know more. I would like to enroll in the Medicare Savings Program or SNAP or HEAP. So that's been really great for us as well. So the lessons learned, as I mentioned, the process of starting with Blooming Health and where we are today, it was quite slow in the beginning as we were trying to figure out how the system works, what works for us, what doesn't work for us. The staff at Blooming Health were super helpful through the process, very helpful in figuring out what works in Broome County, what other ideas do they have from other agencies that they worked with in the past, and we were able to apply it to our needs. We worked really hard on tailoring the wording to be concise, to keep the messages short and easy to follow, because it's very hard to get a long message on the phone. And for some older adults got really confused, didn't finish the message, or didn't want to finish the message listening to it. So that's, I feel that year or two, we've gotten way better about it or at it. And it's helped us with the response to those messages. We really try hard to keep the format standardized. So it basically sounds similar every time the message goes out. Obviously the content's different, but our clients have become used to the messaging. It's recognizable, less confusing and concerning, especially considering how many scams are out there. And seniors are, we've talked to them for years about careful about the messages you receive. And I think keeping it standardized helps us be known and less scary to older adults. We really carefully monitor a number of messages that go out to people to avoid people disenrolling from the system because they're feeling overwhelmed. We make sure that the right messages go out to the right group that are who are registered with our system. So for example, if somebody signed up for general OFA messages, and that's again, thousands of people in that group, we try not to send out more than one message to that large group a week, because when we did that maybe 2 days in a row or, a couple times a week, people called and said, it's a little too much. Can you take me off? So it's really something we carefully look at. We have one designated a Blooming Health Coordinator, which is myself, and I send out all the messages. I try to keep them consistent and standardized. And having that one person approach really helped us stay on top of it. Like I said, the messages are pretty consistent. And as I mentioned earlier, we do use it for client satisfaction data, which saves a lot of staff time and provides us with data immediately. We've pretty significant impacts on our services. It helped because we're being so consistent with how we use the messaging system. We've been able to enroll more older adults, and of course, also lower the number of older adults opting out. We have seen an increase in attendance for events where we use Blooming Health to send out promotional messages. We believe that us using Blooming Health has really supported our age-friendly strategies that we define in our age-friendly project. And as I mentioned earlier, it really fits in with our multi-method approach: printed materials, word of mouth, staff promoting events at centers. So using the messaging going directly to phones and voicemails. It's really great to be able to get the message out in multiple ways. And of course, we feel that it's been very beneficial in our efforts to combat social isolation. Some of the examples, as far as the impact, we looked at our attendance at our Valentine's Day event, which almost doubled in attendance compared to 2023. So in 2023, we had 365 attendees at our Valentine's Day event, and in 2024, that number was up to 672. Same thing for the holiday party, comparing 22 to 23, 517 meals served at the holiday party in 22, up to 746 in 2023. And then the Blooming Health survey that Blooming Health sends out, the percentage of respondents categorized as lonely decreased from 43% to 33% between March and November 2023. So again, it continuously helps us get the messaging out, get people out into the community to our senior centers. We also use it for emergency messaging, but at this point, it's been a wonderful tool for Office for Aging. If you have any questions about how we've used the system, or if you want to see any of our surveys that we've created for Blooming Health through the Blooming Health platform, please feel free to reach out. I have my email here and my phone number, and thank you for listening.